Hello friends, today we'll be discussing a topic that is research and types of study in research. Along with that, we'll also discuss the difference between research, audit and service evaluation. And lastly, we'll discuss about evidence, levels of evidence and grades of recommendation. These are frequently asked questions in the post-graduation exams of many specialities, rather all medical specialities, and also sometimes in the post-graduation SS exams. So today we'll be having a basic overview of these topics, and the link for the notes will be given in the description and is available on the Telegram channel. You can download it from there and it will be helpful for quick revision during the exam. So without further delay, let's get started. So research. So in research, here we attempt to derive generalizable new knowledge, which includes studies that aim to generate hypotheses as well as studies that aim to test them. So to break it into simple words, तो रिसर्च क्या है कि यहाँ पे हम कोशिश कर रहे हैं जनरलाइज्ड वे में नया नॉलेज ढूंढने के लिए या निकालने के लिए, जिसमें हम आइदर ऐसा स्टडी बना रहे हैं जो हाइपोथेसिस टेस्ट करेगा या जनरेट करेगा, या फिर ऐसा स्टडी बना रहे हैं जो हाइपोथेसिस को टेस्ट करेगा या चेक करेगा. सो दिस इज द बेसिक फंडा ऑफ रिसर्च, एंड what worse we can have while doing research is doing the whole research and then later finding out that this research is already done and nothing new has been found out, or reaching the end and realizing that the chosen method is not right or is not correct to support our outcomes. So to understand in English, the worst possible outcome of research is to find out at the end of long arduous study that the research has already been done and that the chosen methodology did not support investigation of the primary or secondary outcome. So before doing or before starting any research, we should have these questions and their answers in our mind so that our research is fruitful, and this will be helpful for us to giving answers regarding to research questions. So what are the questions? So first is, why do we do the study? Will it help? Will it add something new? So is it necessary? Is it helpful? That is the question. Then will it answer a useful question? So whatever hypothesis or whatever question we have, will our research give any solution or any answer to the question? That should be the answer. That should be the goal. And third, is it practical? So whether we are, whatever research we are planning, will we be able to do with our level of knowledge and level of care we have? Next is, can it be accomplished in the available time with available resources? So do we have sufficient number of time that we have planned? Like if we have planned a very big research, then we may not have that much time, or uh, as per the deadline, or we may not have the resources or funding for the project. So we have to consider. Next, will the project benefit from collaboration to increase number or make best use of high-tech equipment? So collaborating with others, other team members or other professional, or using high-tech equipment, will that benefit our project, benefit our research? That should be a question. Then we should have a rough expectation in mind, what will be our finding, what could be our finding, like will that be will research question will give us a positive outcome or a negative outcome or a mixed outcome. Next is what are the research governance requirements. So what are the basic requirements for us to getting an approval from the research governing bodies? Then what are the ethical issues? So is there any chances of our research project getting rejected due to any ethical issues that is not allowed in the research governing body, that is not allowed by the research governing body? Then at lastly, what impact could we have? So after all the research, how will it affect the final practice or how will it affect the care of patients? So this would be the some of the questions which need to be answered before undertaking any research. Now we'll be seeing some types of study or types of research which we do. So coming to types of study, first of all, and before going into detail, it would be nice if we can see the much detailed classification of research. So medical research. So we can classify medical research into primary research and secondary research. Then the primary research is further classified into basic research, clinical research, and epidemiological research. The basic research is classified into theoretical research and applied research. To go in detail, the theoretical research will be based on method development, which could be physics, chemistry, biology, psychology, bioinformatics, or biometrics. Then it can also be analytical measurement procedure, imaging procedure, biometric procedure, or test development assessment procedure. In the applied basic research, we can have animal studies, cell studies, genetic engineering or gene sequencing, biochemical engineering, biochemical research, material development, and genetic studies. Coming to the clinical research, it could be observational or experimental. And in the experimental, we have clinical study that will have 4 phases. Then in the observational study, we have therapy study, prognostic study, diagnostic study, observational study with drugs, second data analysis, case series, and single case report. In the epidemiological research, we have experimental and observational again. In experimental, we have interventional study, which could be a field study or a group study, and randomized trials will be included in these studies. Then we have observational studies, which will include cohort studies, which could be either prospective or retrospective. Then case control study, cross-sectional study, ecological study, monitoring and surveillance, and description with registry data. And lastly, in secondary research, which is analyzing the primary research, which includes meta-analysis and systematic reviews. So these are some types and classification of research. To understand these research in detail, sorry, to understand this research in detail, we will see these in detail. So what are these observational studies? Observational studies, here we evaluation of condition or treatment in a defined population. So we take a condition or any treatment and we evaluate this in a defined population. It could be of two types, either it could be retrospective or prospective. In retrospective we analyze the past events. So जो पहले हो गया है वो हम एनालाइज करेंगे in retrospective. In prospective we will be collecting data and going ahead. So collecting data contemporaneously. So this will be observational study. Then we have case control study. In case control study, we'll have series of patients with particular disease or condition, and we will compare with the matched control patients. So इसमें हम एक डिजीज लेंगे या कंडीशन लेंगे ऑफ नंबर ऑफ पेशेंट और उसको एक कंट्रोल ग्रुप से कंपेयर करेंगे. देन क्रॉस सेक्शनल स्टडी. क्रॉस सेक्शनल स्टडी, here measurements made on a single location, not looking at the whole population but selecting a small group and expanding result. So in this we will take the measurement on a single location, यानी एक ही बार में हम चेक करेंगे in a small group, एंड उस स्मॉल ग्रुप को हम उस स्मॉल ग्रुप के मेजरमेंट्स को हम एक्सपैंड करके रिजल्ट बनाएंगे. एंड लॉन्जिट्यूडनल स्टडी में हम measurements are taken over a period of time, not looking at the whole population but a small similar group and expanding result. तो इसमें हम small similar group को लेके उसके measurements over a period of time करते रहेंगे, मतलब मे बी 6 months, मे बी 1 year, एंड उससे रिजल्ट्स को एक्सपैंड करेंगे. Then coming to experimental studies, here 2 or more treatments are compared and allocation to treatment group is under the controller or research. So इसमें क्या हो रहा है, 2 या 3 ट्रीटमेंट को कंपेयर किया जा रहा है और किसको क्या ट्रीटमेंट देना है वो कंट्रोल जो है वो रिसर्चर के हाथ में है. अब इसी को रैंडमाइज किया जाता है जब 2 किसको क्या ट्रीटमेंट देना है, एक्सपेरिमेंटल को ही रैंडमाइज किया जाता है जिसमें क्या ट्रीटमेंट देना है वो रैंडमली एलोकेट किया जाता है. और जब रैंडमाइजेशन के साथ कंट्रोल ग्रुप भी है जिसमें कोई स्टैंडर्ड ट्रीटमेंट दिया जाता है तो उसको रैंडमाइज कंट्रोल बोला जाएगा. तो रैंडमाइज कंट्रोल में क्या होगा, इंक्लूड्स अ कंट्रोल ग्रुप विद स्टैंडर्ड ट्रीटमेंट. सो 2 रैंडमली एलोकेटेड ट्रीटमेंट विद कंट्रोल ग्रुप विद स्टैंडर्ड ट्रीटमेंट. So this was all about the details of these studies. Now coming to the next topic, that is these studies in the increasing order of quality of data. So now we'll see these types of study in the increasing order of their quality. So the lowest one, this is the research pyramid we can say in the increasing order of the quality of data or quality of evidence. So the lowest one is the background information and expert opinion. And what does these include? These include textbooks and resources from Access Medicine and Clinical Key. So this is the very basic data. Then we have some unfiltered information. So what are these? These are case reports and case series, case control studies, cohort studies, and randomized control trial. And what these include? These will include data from Midline, PubMed, and similar internet resources. Then coming to the filtered information, which will have critically appraised topics, systematic reviews, and meta-analysis. So the critically appraised topics, these will include data from First Consult, Dynamed, which are online platforms, and Hippocrates Essential and National Guideline Clearinghouse. Then we have the highest level of data, that is the systematic review and the meta-analysis. So these will be from the Cochrane database of systematic review or database of abstract of review of effectiveness, that is DARE, or Campbell collaboration library of systematic review, or TRIP. And TRIP is a special thing which searches filtered and unfiltered information simultaneously, so it has added advantage. So this was all about the levels of increasing order of types of research. So the best is systematic review and meta-analysis. The best will be meta-analysis. So this was all about types of research studies and research studies in increasing order of quality or evidence. And the rest of the topics, that is differentiating research, audit and service evaluation, and levels of evidence and grades of recommendation, we will discuss in the next video, as this video has already become quite long. So hopefully see you in next video. Keep studying, keep growing. Thank you for watching, and please like, share and subscribe. Never give up, because great things take time. Thank you. See you in next video soon.